Hi, I'm Kristen, and I specialize in pelvic floor physical therapy. So I was a field hockey athlete at SUNY Geneseo, and I had a lot of time with my athletic trainer who got me into physical therapy. So I wasn't sure what I wanted to do when I was at Geneseo, and being in the training room surrounded by athletes and just working through their injuries as well as my own injuries got me into physical therapy. Embroidery, I think that's a lost art, and I think it's, with all the new TikToks coming out, it's something that's kind of coming back. So to watch my grandma embroider, my great grandma, I would love to just know it off the bat. So I had a 20-year-old female patient who she was going into her master's degree for teaching. And with all teachers, can't be in the bathroom every 30 minutes. Unfortunately, she was, due to a lot of irritation, burning, pain with urination, as well as pain with intercourse. So being 20 years old, kind of having all of that happen to you, a lot of doctors didn't know what was going on with her. So they sent her to pelvic floor physical therapy. We were able to properly diagnose her, got her through a lot of her symptoms, and got her with the right doctors and providers to be able to get her to finish her master's program, as well as have a great relationship with her current boyfriend. Just continue advocating for pelvic health. We have a great pelvic health team here, and I'm very excited to join the team. Pelvic health is an underserved area, so to be with so many like-minded individuals, to just really pursue and keep the ball moving with pelvic floor physical therapy, I'm super excited. I am a huge line dancer. If I am not in the clinic, you will find me at any of the line dancing bars, whether in Buffalo or Rochester, learning the next new line dance. One patient who was from a strict Muslim background. So with her and her husband, we were not allowed to be out in the gym with physical therapy. We always use our gym equipment. So to be able to come up with a program that was not only approved by her, her faith, and her husband, we were able to get through her plan of care appropriately, as well as making both of them feel pretty comfortable. Just to realize that everybody's a human. I feel like a lot of times in the healthcare world, we kind of just get told what to do. So I tell all of my patients, and you can ask any one of my patients, that the first thing I really say is, you are in the driver's seat with care with me. So whatever you are comfortable with, whatever you're not comfortable with, I feel like that really gives someone a true understanding of how their plan of care is going to work, and they are the sole director of that. I'm a resource and a tool to kind of help them move through their plan of care, but having that autonomy, I feel like really gets people through their plan of care. Best piece of advice I've ever seen is, if you're on time, you're late. I love to take on students. I feel like giving back to the community for physical therapy students, as well as just taking on their knowledge as they are learning the current techniques. I'm continuing with all of the continuing ed that's out there, and I'm very excited to partner with Limitless and all of the resources that they have to keep the field moving and to keep learning. Hi, I'm Kristen. Welcome to Limitless.